Welcome to the Women in Sports Therapy podcast from the Sports Therapy Association. We are your hosts.
I'm Fiona.
And I'm Debs.
We're so excited to share this month's episode in which we meet with Emma Belton from Emma Belton Nutritional Therapy to talk about her practice.
Emma is a registered nutritional therapist specialising in women's health and hormone balance. Emma works with people who are experiencing PMS, period pain, endometriosis, menopausal symptoms, low energy and digestive problems, helping them to get their health back in balance and feel well again.
We can't wait to share our discussion with Emma in this episode, which includes her own experience of endometriosis,
how she retrained as a nutritional therapist and now helps other women on their journey to better health,
her approach to working at the pace of each individual and tailor suggestions to their lifestyle.
We really love this catch up with Emma. There are so many great insights and information in this episode.
So without further ado, here is our chat with Emma Belton. Please enjoy.
Good morning, Emma. How are you doing this morning?
Morning, I'm good, thank you. Nice to see you.
And you. It's such a pleasure to have you with us this morning. Thank you so much for coming and joining us about what you do. So with no further ado, I'd quite like you to introduce yourself to all of our listeners out there, if that's okay.
Sure, yeah. So I'm Emma Belton. I'm a registered nutritional therapist and I specialise in women's health. So that can be anything from people experiencing PMS symptoms, period pain, hormonal conditions like endometriosis, polycystic ovarian syndrome, and then I also tend to work with women going through the sort of perimenopause, menopause transition. And then within that, I have a lot of people with fatigue and gut symptoms, whether that's things like IBS and bloating. So yeah, quite a range of things. I am based in Hertfordshire, but actually since the pandemic, I work online. So I actually work with people throughout the UK.
So from national to international.
Haven't quite gone international yet, but certainly national.
We'll work on that, definitely.
Yeah, next step.
Okay, and then obviously you've been doing this for a little while now, having had a look at your website and knowing you for a little while because we met a long time ago at an endometriosis support group. And just so that everyone knows a little bit more about your journey, can you tell us how you got into this and how you got to where you're doing what you're doing now and became what you are?
Yeah, sure. So it was my own personal health journey that got me into nutritional therapy. So yeah, as you said, that I've got endometriosis. So I was actually diagnosed in my late 20s.
Yeah.
But I had problems with my periods from the beginning as a teenager. So I always had painful periods, but I think like a lot of women, actually, you just accept that as the norm. If like from day one, they're painful, you're like, oh, that's how periods are. They're going to be painful. And my mum used to pack me off to school with paracetamols in my lunchbox to get through the day because they were painful. And over time, it just like gradually got more painful. I would have a lot of kind of PMS symptoms. My energy was low and it just kind of progressively got worse. But I just kind of took that as, you know, that's how it is. That's what it's like having periods. And it wasn't until I left home and was at university. And by that point, probably because actually my student lifestyle diet was not great, the pain was kind of getting worse. So I would get pain like maybe a week or so before my period started. I would get really intense pain during my periods. And then I'd also have pain for a couple of days after my periods. And it was actually one of my housemates that said to me, that's not normal. Like, I don't get that. I don't know anyone else that gets that. It's not normal to be walking around clutching your stomach and in bed for a couple of days every month. So I went to the GP, and this is a kind of very familiar story probably to a lot of people with endometriosis. No diagnosis, you're just told go on the pill, that will sort everything out, and of course you believe it. So I kind of went on the pill at 19 and yo-yoed on and off it really for about the next 8 years or so. And yes, it made my cycles more regular. It kind of brought the pain down a level, didn't take it away, but it brought it down a level. But I got lots of side effects with it. So it made my PMS so much worse. I could have really, really bad mood swings. I also used to get high blood pressure on it.
Oh, wow.
So I would have to come off the pill and stop. And, you know, there would be like a carryover effect. I'd feel a bit better for a while, and then the symptoms would kick back in. And then the symptoms would get so bad that I'd be like, okay, I'm going to go back on the pill, and I'd try a different one. And then this kind of repeated. And again, my symptoms were getting progressively worse. And then I started to get cystitis symptoms as well, and was like to and from the GP, no infections, but this kind of like constant bladder pain, real kind of irritation going on. And by that point, I was getting anemia quite a lot, obviously because my periods are really heavy. And I was kind of at the point of constant pain, like throughout the whole month. I was just popping painkillers. I was, you know, struggling to even walk to the end of the road because the pain was so bad, and any movement at all was just kind of making the pain really kind of searing pain. You know, I had no energy at all. I was really tired all the time, and my hormones were like completely all over the place. I was a nightmare to live with. And at that point, my GP finally was kind of like, okay, I'm not really sure what's going on. So it was actually getting the cystitis symptoms that made my GP go, I'm not really sure now what's going on. Up until that point, it was just like, oh, it's painful periods. Some women have it like that. You know, you just kind of need to learn to live with it. So got referred to a gynecologist, had a laparoscopy, got diagnosed with endometriosis. And initially, it might sound strange, but that was a relief, because I was wow, I've got an explanation for my symptoms.
I'm not going crazy.
Exactly, it's not me, it's not just women's problems. It's like there is some reason that I'm in so much pain, that I feel so awful. And so I also got hopeful, because I was like, great, if you've got a diagnosis, then there must be some treatment. And at that point, I didn't know the first thing about endometriosis, so I was all kind of hopeful I was going to get this you know, miracle cure, and sadly there isn't one for endometriosis. So I eventually went back to my follow-up appointment and was told that for me, surgery was not an option to deal with the endometriosis, because I had lots of endometriosis throughout the pelvis, so lots of kind of very small amounts of endometriosis kind of like everywhere. And so surgically, unless you've got someone that's a real kind of expert, that can be quite difficult to deal with.
Emma, just before you go on, for those listeners who may not have actually heard, you know, maybe they've not been able to listen to our previous episodes yet. If you haven't yet, by the way, go and listen to our episode on endometriosis in series 1 to get the lowdown. But Emma, what is endometriosis, and how could you describe that simply, I suppose, for our listeners?
Yeah, so it's an inflammatory gynecological condition where the tissue that grows normally in the lining of the womb spreads outside the womb and starts growing in other parts of the body. So usually the pelvis, but it can be the bladder, it can be the bowel, it can kind of travel, it could potentially be anywhere in the body. Wow. And that tissue responds to hormones during your cycle in the same way as the tissue in the womb would. So it will kind of expand at certain times of the month, and then it will bleed. But obviously that blood is trapped in the pelvis, and that causes the kind of pain and the inflammation. So
gosh, it sounds so painful. Like, just when I've heard Debs talk about it as well, and you know, now you describe it, it's a huge concept, I suppose. If you just heard that you've got this condition, I can understand that like sense of like wonder, and
yet so common, you know. It's hitting over 2 million women in the UK alone. It's so common. Yet it's just
so unheard of as well, isn't it, that people are, you know, like when I was diagnosed, I didn't really know anything about it.
So how did so I'll let you carry on with your story now, because I did read the intro you made.
So I was told no surgery, and so I was told my only option was hormone treatment, and that really scared me, given that I'd never got on well with the pill, to go on like stronger hormones. Personally, I found really scary. And I always remember, it's, you know, like you have certain moments that are just etched in your mind. I always remember the journey back home from that hospital appointment, just crying, because I was like, I'm so desperate, I feel so terrible, I'm so desperate to do something to feel better, but I really don't want to take hormone treatment. And like that was my only option, and having this real like dilemma on feel really uncomfortable taking that hormone treatment, but at the same time I can't carry on in, you know, the way that I have been. You know, it's really affected my quality of life. So someone said to me, why don't you try some type of alternative therapy? And up until that point, again, it was not something that I'd ever really tried or knew much about. And so I kind of decided that I was going to give myself 6 months to try and find something that would help that wasn't hormone treatment. But equally, I was like, if I can't do that in 6 months, I'm going to have to do the hormone treatment, as much as I don't want to.
Plan A,
So,
plan B.
yeah, exactly. Yeah, give yourself options. So
Awesome.
obviously, my motivation to find something was high. You know, at that point, I was so desperate. I would have done anything. If you'd have told me there was a vague chance it might have made me feel even slightly better. So yeah, I dabbled in quite a lot of alternative therapies. And yeah, after a few months, one of the things I tried was nutritional therapy. So I found a nutritional therapist who also had endometriosis. And it was such a relief to talk to someone that understood that level of pain and what living with that pain was like, but also understood your description of pain. So I was trying to kind of get across to my GP and gynecologist what the pain was like. You know, it was not like anything I'd ever experienced before. And they used to, I have to say, my description was probably a little bit strange, but they used to look at me like I was insane or something. And then I spoke to this nutritional therapist straight away. She was like, because I was saying what it felt like was someone kind of like shoved their hand into my pelvis, grabbed hold of every organ, pulled it as hard as they could, and then twisted it. And as soon as I said that to her,
Really good description.
Yeah, you get quite graphic, I think, when you've got that kind of level of pain. And straight away she was like, oh, you've got adhesions. That's the kind of like tugging, pulling pain. So adhesions are where the kind of endometriosis starts effectively sticking things together that shouldn't be together. So that might be a bit of endometriosis, it's kind of sticking to the wall of the pelvis, or it might be sticking to the ovary or something. So you get this kind of like pulling, tugging sensation, feeling. And she was like, well, that's what that was. And I was like, well, no one else has ever been able to kind of explain that. So she put me on initially what was kind of quite a harsh exclusion diet. They basically cut out almost everything that I ate, different things, put me on a range of different supplements. And because I was feeling so desperate, I did it to the letter. It was really tough, particularly when you were tired and in pain, to have to make a lot of changes to your diet. But I did it, and very slowly, very gradually, I was noticing a difference in my symptoms. It started to improve. The pain wasn't quite as intense. I didn't get it quite as often. It really did not happen overnight. You know, this is not a quick fix. It was very much a kind of slow, gradual process of improvement. You know, there were kind of ups and downs along the way, but it made enough difference that I was like, I'm going to stick with this. I'm not going to do the hormone treatment, which was obviously what I was ultimately trying to avoid. And slowly, gradually, I started to feel like my health was kind of getting more on track. So I think one of the big changes for me was the diet and the supplements made a difference. It got stuff to a lower level, it got me feeling better, but I was still, getting a fair amount of symptoms every day. It was more manageable, but it was still a bit of a struggle. And then I started adding in some of the lifestyle stuff, which is so important. So that, managing your stress levels, trying to do some exercise, making sure you're getting good quality sleep, getting in some relaxation, all that kind of stuff that I hadn't done at all. I was just like, diet, supplements, that's all I need to do. And then I put the lifestyle stuff in, and then I really started to kind of get more improvement, and definitely see things where we're getting in control. And until I got to a place where I was like, the endometriosis is no longer controlling my life in the way it used to. I used to book holidays around when my period was due so that I wasn't going on holiday and just spending the whole week in pain. And it's like I didn't have to do that anymore. My pain, I didn't wake up in pain every day. I had energy to do things. And so yeah, I guess I kind of got a bit hooked then on the whole nutrition. And I was like, right, there's something in this, you know, I really want to know more. I want to understand how that worked, how that happened. So I had to wait a bit. I had to wait until I got my health to a better place, and so that I could get my energy levels back up, so that I could actually manage to study and still do another job part of the week as well, to kind of afford to be able to study. So yeah, eventually I then got to the point where I retrained as a nutritional therapist. And again, even though I was studying, that really helped my health, because every time I was like learning more about what might have been going on, what I could do to try and manage the symptoms. So my little toolkit of things that I could try was growing all the time. So yeah, that is how I got into it. And I always kind of knew when I was doing it that I wanted to help women going through a similar situation, you know, struggling with either endometriosis or, you know, other hormonal conditions, and knowing that there is that kind of power in nutrition and lifestyle measures to help people get back on track, not necessarily to, you know, make everything miraculously go. I wish we could, but that's not always the way. But we can certainly manage the symptoms and make things a lot easier for people. But part of it for me is also that kind of almost like raising awareness of some of the symptoms, helping people understand why doing certain things, like for example managing their stress, is going to have an impact on hormone levels or health, and then like giving them the tools and the tricks really to know how to manage that themselves, so that long term they don't need to actually keep seeing a nutritional therapist or whoever it is. They just have got that toolkit to be able to manage that condition themselves.
That's great, Emma. Thank you so much. There's so much information. My brain's gone, oh, wow. What do I ask her next? So absolutely, not just, I say not just endometriosis, but not just endometriosis. There are a lot of other hormonal fluctuations that also happen in men, and people that identify as a man, identify as a woman. We have all sorts of stuff that fluctuates in hormonal balance. And it goes back for a long time ago where people say you are what you eat, you know, and all these little buzzwords. But it's not, like you're saying, it's not just about what you eat, it's your whole lifestyle, your whole health, looking at, you know, how do you do things daily. You know, one of the things I ask in my clinic is, as a whole health practitioner, I'm looking at, you know, what do you do in the morning? Where do you go? Like literally, what do you do? And then what I'm trying to do is fit in to their routine, stretches. Are they eating everything correctly? You know, do they walk the dog in the morning? Who do they come home to? You know, because that's really relevant to how you feel and what goes on in your life. So totally understand where you're coming from in that respect. And how did you get from being part of it and working with a therapist to becoming a therapist yourself? Like, what did you have to go through to get those steps in place?
Yeah, so I think that the key thing with nutrition training is there's lots of different things out there. So you sometimes see, I see it in my social media feed quite a lot, something saying, oh, be a nutritionist, do this kind of 6-week online course. And, you know, I'm sure you get lots of really helpful information to help you and others eat healthily doing that. But I knew that I wanted to do the kind of full in-depth nutritional therapy training, so that you've got that expertise on, you know, really complex health conditions and how to support people. So I did a 3-year training course. So it was a diploma in nutritional therapy. And in that you get almost like the kind of theoretical input on, you know, how the body works, different health conditions, different kind of nutrient supplements, the impact they have on the body. So you've got that kind of theoretical understanding to draw on. And then what really attracted me to the course that I took was that you also did 200 clinical hours before you qualified. And I think for me, that is where you really get to put that learning into practice and apply it. So, you know, you're in lectures and you have like a day on the digestive system, and then you have a day on, you know, menopause, for example. And I always remember one of the first cases I worked with in the clinical practice, and I had this lady sat in front of me who was going through the menopause and, you know, getting a lot of symptoms like hot flushes, night sweats, etc. But she'd also got IBS. and was getting a lot of problems with that as well, and was having to be really careful about what she could eat. And it was that real kind of like the moment where you kind of learn with nutritional therapy, it really is about tailoring it to the individual, because a lot of the stuff we've been taught about foods that would help with menopause symptoms were actually going to make this lady's IBS worse. So it really is, tailoring it to that individual. What do they need? What is going on? What kind of food, supplements, lifestyle is going to work for them? So you can have, two people with the same condition, but you might approach it in a very different way, because we're also, different in terms of our diet, our lifestyle, our genetics, how we experience symptoms and things. So really is tailoring it to that individual. So as a registered nutritional therapist, so I'm registered with BANT, which is one of the main bodies for nutritional therapists. You only can get that registration if you've done a course that's kind of accredited by them. So they're usually courses that are 3 or 4 years in length, and have a certain number of clinical hours as well, so that you've got that practical experience of working with clients and putting some of your learning into practice.
Thank you. That's incredible. I think you're absolutely right. A lot of people can call themselves a nutritional therapist and have done a little tiny course. To know that you are so in depth and you wanted to go that step further to make sure that you're giving the best. I know you a little bit, Emma, as well. So I kind of know how you work. So there's an element of, I know that you're deeply caring, and I know that when you see people, you actually are incredible at working with those people, like you say, on an individual basis, to make sure that the best outcome is for them. I know that of you already, because we've spoken about that before. However, I think to hear it from you as well, and how you've got to that, is incredible. Over to you, Fiona. Ask some questions.
I was just going to say, from a perspective of a sports therapist or manual therapist, the people in our audience that make up our audience are a mixture of backgrounds, I suppose, and we might not have knowledge of nutrition and the sort of extensive way in which that might influence the outcomes in our clinic. So it's not an area of expertise that we're really able to advise on. Like Deb says, we rely on practitioners like you, but if you could describe the ways in which, particularly people that come to us, if we find somebody who's experiencing pain and perhaps they're showing symptoms like you've described of endometriosis or other hormonal conditions, how can nutrition be used to help our clients? Like, would you work in collaboration? Like, how does that work? Do we refer to a particular people? You mentioned BANT and certain professional bodies. How does that work?
Yeah, so I think nutritional therapy can work really well as a standalone or alongside other therapies. So, sometimes I work with people who are perhaps also going and having acupuncture or reflexology, or equally people who are also in the conventional medical system and might be taking medications for, pain or hormonal treatment or something. You can always work alongside others. Obviously, if people are on medication, we just have to be very careful around supplements and making sure that there aren't any interactions between whatever supplements we might be suggesting and medications. So I would always kind of be, checking that out just to make sure. But definitely, I think with a lot of conditions, it can often be helpful to come at it from different angles. So, say, for example, if someone is experiencing pain, I know that, personally, when I had a lot of pain, I was tensing a lot of muscles without even knowing it. So I just had like really tight pelvis muscles, and I wouldn't have known that initially, but it was that, that pain, you're kind of like guarding, you're trying to protect in a way, so you kind of tense muscles. So, the nutrition was really great at reducing the inflammation, reducing the pain, but actually it wasn't really doing anything for those tense muscles. So absolutely, working in conjunction with someone else, you can kind of, one person can come at one angle of the problem, someone else can come at another angle. And when we're and I always do quite a detailed assessment. So that would include, you know, are you working with other practitioners, and you know, what are they working on, what have you found helpful in that. But also I would not just be, so say for example, if someone came to me with endometriosis, as part of that assessment I'd be looking holistically at the whole body. So obviously we'd be focusing on the endometriosis symptoms, but you know, that would also include you know, are you getting like joint pain, back pain, are there any issues going on in terms of, I don't know, like respiratory system, or you know, your immune system, which is often quite linked with endometriosis. So we're definitely looking at what else is going on in the body, what systems are out of balance, and then how can we try and address some of those imbalances. And it might be with food and the diet, it could be with supplements, it could be with lifestyle issues, as I mentioned, but also it could be actually, you know, maybe it'd be helpful to go and have some acupuncture to help on that angle of the problem, or you know, have some massage or something. So you know, absolutely we could be, you know, suggesting a referral on to someone else, or equally, you know, receiving a referral from another practitioner that's worked with someone and said, oh, actually, I think, you know, it might be also helpful to look at diet. So particularly, you know, anything pain related. I've talked a lot about endometriosis pain, but any inflammation in the body, whatever cause there is for that, then there's a lot you can do with diet to reduce inflammation. So, you know, you've probably heard things around about anti-inflammatory diets, but there's lots of foods that have an anti-inflammatory effect in the body. So it's looking at, you know, is that individual eating many of those foods? Can we increase some of those? Equally, there are foods that have an inflammatory effect in the body. So you'd be wanting to kind of, you know, reduce some of those foods if they're in the diet. There are things we can do nutrition wise in terms of supplements to either reduce inflammation, to look at helping with pain levels. You know, there's also things we can do in terms of like joint health, that kind of thing. So, you know, I think it works quite nicely. And if anyone's looking for a practitioner, I mean, you know, probably like myself, a lot of nutritional therapists now work online, so that you haven't really got that geographic restriction. You know, you can work online with nutrition. It's not something like massage, it's hands-on. You obviously need to be there. But yeah, if you're looking for something local to you, or a nutritional therapist that specialises in a certain area, like, you know, sports nutrition, for example, if you go on the website of one of the registered bodies, so like BANT, for example, they have a practitioner directory, so you can search by postcode, or you can search by area, like women's health, for example, and you'll see kind of practitioners come up that might be in your area or have expertise in whatever condition it is that you're thinking might be helpful to get some support on.
That's amazing.
Great.
Wow.
Yeah.
I think we'll probably have quite a few people Googling BANT after hearing this. British Association of Nutritional Therapy.
Nutrition and Lifestyle Medicine. The acronym doesn't quite work, but yeah.
Wow. Yeah. Well, it sounds like an amazing opportunity, you know, for us to kind of widen our referral routes and signpost. And I guess if any of our listeners are, you know, therapists who are experiencing these kind of, you know, experiencing symptoms, then that's an option for them. So as nutrition is such a wide area, I guess if we circle back to your kind of like background and training, it's such a big subject, nutrition. And I think certainly in more recent years, we've seen this kind of increase in interest in nutrition, for particularly in the health and well-being and fitness kind of sphere. And fitness is an area that perhaps overlaps somewhat with sports therapy and related fields. So I think that there's an amount of wariness about adopting, you know, different kinds of diet, and there's a diet culture out there, especially on social media. So I know our listeners are really interested in sort of evidence-based practice, but also broadly like other more traditional kind of treatments from other cultures, and historically like acupuncture and crossing over into dry needling, and you know, nutrition is a big subject. So what's the background in terms of like the influences on your practice? Because you've mentioned you did a 3-year diploma, which is a fantastic opportunity to get, and clinical experience to get the information you need. What types of influences are there on your practice and the requirement to be part of, you know, a member of BANT?
Yeah, so I mean, certainly we would try and go for an evidence-based approach where we can. I think it's fair to say that there isn't the same level of evidence around nutrition as there would be on, for example, like medications, where you get large randomized control trials with thousands of people. Sadly, there just isn't the funding for that in terms of nutrition research and, you know, what does vitamin C do in the body. So there is research out there. You know, there aren't a huge number of randomized controlled trials. There are some. The sample sizes generally tend to be smaller than, you know, you'd see in a lot of medications research, but there certainly is evidence on the impact of certain kind of nutrients on the body, or certain kind of protocols in terms of food, diet, in terms of the impact on particular health conditions. So certainly when I was training, a lot of the kind of evidence that we were given in terms of, you know, if you're working with someone with, for example, arthritis, you know, these kind of protocols, these kind of supplements help. The majority of that, I would say, was evidence-based. There was research behind it to back it up that said, you know, we've done this with a group of people, this is what we found in terms of results, you know, X% improve, etc. And certainly in the women's health field, which is, you know, largely what I specialize in, you know, in endometriosis, polycystic ovarian syndrome, kind of perimenopause, there are certainly research studies that suggest that certain foods or certain nutrients that we might put in supplements, for example, have shown to be effective. So where I can, if the evidence is there, then I draw on the evidence in terms of the recommendations. But, you know, you're quite right, there are not everything has got research evidence, or there might be sort of emerging evidence. So there is, I would say, the majority of what I can do is evidence-based. There is some that I would say is based on what I call practice wisdom. So again, certainly when I was training and doing the kind of clinic hours, we would have practicing nutritional therapists kind of supervising those clinics. And, you know, they would give examples from their practice about, oh, you know, I found that this particular thing is helpful in working with people with this condition. And yeah, certainly sometimes myself, I would draw on things that I found helpful, or things that I've tried with clients and their feedback has been, you know, that has been helpful. So sometimes if you haven't got the evidence, you have to go on that practice wisdom. And I think particularly maybe some of the lifestyle stuff is a little bit more practice wisdom than some of the kind of diet and supplement stuff that's around.
And that's also trusting, Emma, that the clients are actually doing what you ask them to do. So a lot of the time we can evidence based on people, so studies that have actually happened, and they are, whoever, so 5 people have done this and they've all come with these results. How did they do it? What were they doing? Did they actually do it to the letter? You know, each person is an individual, and is your client doing that? And also there's interjections of other conditions that happen. So for example, with endometriosis, you can often have an autoimmune system that's defunct as well. You often have IBS with endometriosis. There can be skin conditions. These are quite standard. Once you have endometriosis, other stuff kind of starts going wrong. But whatever else there is with somebody else, so for example, somebody that has arthritis, for example, it could be that they have other contraindications, and even if it's an evidence-based study on 5 people with endometriosis, 5 people with arthritis, there could be other things going on as well. So we can only evidence-base certain levels depending on other fluctuations of that evidence, I guess.
Yeah. Absolutely. And I think that's partly, I think the really good point you made there about, like, are people doing whatever you've suggested that they do, and how are they doing that? So part of my approach with people, particularly for anything that's a more sort of chronic health problem, so whether that's endometriosis, any kind of hormonal thing that's going on, I tend to work with people on kind of packages, programs for about 3 months, and sometimes we go a bit longer than 3 months. So for exactly that reason, really. So part of it is giving people that advice, but part of what I see my role is to actually help them implement it. And like you were saying, Debs, you know, finding ways that they can fit these things into their day, or they can get these feeds into the diet. And so by having that kind of 3 month period, you can start to do that, and you can kind of check back in with the clients, you know, in a couple of weeks time. Okay, how have you found trying to introduce more vegetables, for example? It's not gone well. Okay, let's think about how we can make this a little bit easier for you, and give you some suggestions of how you can sneak in an extra portion of vegetable and the rest of the family don't realize that they're eating extra vegetables. So it is very much trying to make it work for your client. I think it doesn't work. You know, what I did, which was just get a list of things, like cut out all these things, is just not sustainable for most people. And that's why people then stop and go, you know what, nutrition didn't work for me. Actually, it was because it was too hard and they didn't have that support to implement it. So my approach is very much, we work at the pace of the individual. You know, we're all busy. If someone is in a lot of pain, tired, trying to work, got children, their capacity for changing their diet is quite limited. So we might just be changing like one thing or two things, and we kind of see how that goes. We find a way of fitting that into their lifestyle, and then we might add on it and do it gradually. You know, we're all different. Other people are like, yep, throw it at me, I'm going to do it. So yeah, you do have to kind of find ways of working with people, and people will go at different paces, and that's fine, because ultimately we want to make it sustainable. We want to make it something that people can just fit into their lifestyle and becomes part of what they eat and what they do, and isn't that, oh, I'm on this special diet for this condition. It's just, you know, this is how I live, and this is how I manage the condition. And it shouldn't be something really restrictive. Or sometimes I see people and they're worried because they're like, no, I'm tired, I don't have much time, I can't cook everything from scratch, I can't be like pre-soaking chickpeas for hours or whatever and coming up with this, you know, special chickpea stew. And it's like, I don't do that, that's not practical, that's not real life. So my approach is very much try and make it real life.
That's lovely. That's exactly how I work as well, real life situations. So we're just going to carry on sort of bombarding with questions, actually, Emma, if that's good for you. If you need a break, let us know. We'll just pause
No
for
worries.
moments. Thank you. So if we want to guide our clients towards using nutrition to aid their health, or if they need injury recovery, what recommendations can we make so that we're putting them in the right place?
So I think sometimes it is often the things that we might think of as like little things or really simple things actually can make a big difference. So, you know, just things like making sure you're staying well hydrated. You know, every cell in the body needs hydration to work, to kind of lubricate the joints. So, you know, if you're in pain, to kind of make sure that you've got fluid, you've got stuff pushing through, that's going to help your digestion. So even just really simple things like staying well hydrated, looking at what you're drinking. You know, if you're drinking a lot of like high sugary drinks, actually the sugar is inflammatory, so that is not going to help if you're in pain or got some inflammation going on. You know, same thing with diet. If you're eating a lot of, you know, I think very often when we get tired and we're struggling, or we're in pain and we're in low mood, we kind of get attracted to the kind of sugary snacky food, like the kind of chocolate, the sweet cakes. Yeah, we want that kind of comfort food. And it does give you that initial spike of energy to kind of get you through the rest of the day, but then it's going to give you a big crash. So just, you know, steering people actually into a kind of slightly more healthy way of eating, and getting in more fruits and vegetables, or thinking about, why are you eating a snack? You know, are you really, really hungry and tired and struggling? In which case, maybe going for a protein-based snack like nuts or seeds might help. Or, you know, are we having a snack because we're bored, or we're fed up, or we're feeling miserable and we want to make ourselves feel a bit better? Or can we find something else to do that would, you know, help us with that? So I think, you know, absolutely, there are just kind of basic healthy eating fluids, etc., that are really helpful. But depending on someone's condition, you know, if they've got something like a kind of autoimmune condition that's causing pain, joint problems, osteoarthritis, rheumatoid arthritis, anything like that, then I think, you know, getting maybe some specialist guidance from a nutritional therapist on the type of way of eating that would be helpful for that condition can be really useful. So I think even just kind of making those suggestions to people that, you know, you've tried X, Y, and Z, maybe that's kind of another thing that you can throw into the picture to help manage that condition.
And then refer them on to a nutritional therapist. So start there and then say it might be worth, to manage pain, to manage nutrition yourself, to just get some actual professional support from a nutritional therapist. Here's the list, go onto Google, go onto Vans and check out your area. Right. Or send it straight to you, Emma. You'll be inundated with people. And
absolutely. And then what we would do would help them to come up with a plan. And that could be about food, it could be about supplements, it could be about lifestyle, it could be a combination, but a kind of plan of things that then they can put into practice alongside whatever else they might be doing, to kind of help them manage that condition.
Emma, do you think, I was just going to say, do you think that, I mean, from our previous episodes, I suppose our audience who've listened to those might kind of remember that we are big advocates of tracking our, menstrual cycles, because that in itself, just having that information can be so helpful, spotting patterns and symptoms that could be linked to hormonal fluctuations. Would there be a benefit to maybe extending that to tracking food? I guess, I suppose it sort of seems like quite a simple thing. It can be quite time consuming. You're nodding your head for those who are listening on the podcast. Emma's nodding her head. So are there any hacks or any apps or anything you could recommend for doing that?
Good question.
Yeah, I mean, I tend to do it with people that are experiencing digestive symptoms more than anything, actually. So if someone's getting bloating or IBS, then very often we would then get into a discussion about, have you noticed if you eat a certain food, does that make it worse? I have to say, with people I work with, very often they know that, they're kind of aware of that already. So I tend to not get them doing kind of a lot of recording, because sometimes that can just be like an extra thing to do and an extra stress. But if sometimes people will come and say, oh, no one's ever asked me that question before, I've not thought of it. So then what we might do is do a kind of food diary and maybe just score the symptoms out of 10 just to see if you notice. I think the challenge is sometimes people, depending on kind of what it is and how your body reacts to it, you may not notice the symptoms straight away. So you may, for example, for me, wheat can be a bit of a trigger, but I may eat it and I may not get any symptoms that day. It might be the day after. So then it becomes quite difficult sometimes to link, well, I've obviously eaten other things other than just wheat. What is it that's causing the flare up? Another situation I find with bloating sometimes, which can be quite common with a lot of hormonal conditions, actually, people can often experience bloating as well. And usually by the time people come to see a nutritional therapist, this isn't occasional bloating, this is probably most of the time bloating. And then it becomes really difficult, because it's well, it's all the time anyway, so how do I know what food is doing what, because I'm permanently bloated? So sometimes then what we have to do is do some work on trying to get to the root cause of what is it that might be doing the bloating, and calm that down a bit, or maybe doing some kind of gut support. And then sometimes as the symptoms start to ease, people are then now I'm noticing that when I eat wheat or gluten or dairy or whatever it is, that suddenly the bloating gets worse. So it can be useful, but sometimes equally it is a little bit tricky to see the pattern. So sometimes people can get a bit frustrated with that. But it's the kind of thing, I think, that if you're working with a nutritional therapist, just in that kind of assessment and digging down, we would try and pick and see if that is an issue between foods and symptoms.
Yeah, it's complex, isn't it? And when you were talking earlier a bit about the influence of diet on hormones, I was just thinking about how broadly, I mean, that applies in our field of, manual therapy, sports therapy, because there are so many factors involved in creating our experience of existing, environmental factors that we don't have any control over, and things that particularly exacerbate stress. We often don't have control, and providing that we take control of all the measures that we can control, that's a mouthful, there's a possibility that we can improve our situation, our symptoms, if we but things like food, like diet, and exercise and stress where possible are things that we do have within our remit of control. So it's just very, like you say, it's very hard to pinpoint which of anything out there is actually causing the problem.
Yeah. And I think in reality, often with the people I work with, it's not one thing, it's a combination of several different things. So you have to kind of work on several angles, and often it is a bit of detective work. So, you know, you might try one thing. Does that make a difference? Does it not? What level of symptoms they got left? Okay, there must be something else going on. So then trying to unpick that. But yeah, I think there's a lot we can do. I mean, you mentioned the stress thing. I would say the majority of people I work with, like, stress is a big driver in their symptoms, because often having those symptoms of, you know, pain, hormone symptoms, that's stressful, and you get in this vicious circle of, you've got these symptoms, that's making you stressed, the stress is making your symptoms worse, and how do you break that circle? And, you know, very often we can't remove the sources of stress in our life. There might be some things, but, you know, a lot of things we can't suddenly, like, stop working or something, or, you know, change our living situation or something. But we can do things to try and minimize the impact of stress on the body. And I think that's a lot of what I tend to kind of focus on with people, is just getting something in every day if you can, and that might be 5 or 10 minutes, but just something that helps get your body out of that high stress state where you're pumping out loads of cortisol that's then, you know, increasing inflammation, it's making your hormones imbalanced. Just doing something, whether that's going out for a walk outside, or a few breathing exercises, or gentle stretches, or whatever it is, just to kind of get your body out of that high stress state and into that kind of rest and digest state, and get those cortisol levels down over time, can really make a difference. So again, it's going back to, you know, the little things. And I know equally when people are tired and stressed, saying find 10 minutes a day can actually feel like a massive deal. But if you can do it, you know, it really will help, really will make a difference.
So going back to the quick question I was going to grab, is the acute situation. So often when people are coming to you, they may have chronic conditions, and then it becomes acute, and then they say, I need help. Is that what you normally get? That's the sort of clients that you normally get, and we're kind of at crisis stage? Or do you get people along the way that have been referred because something might be a bit sticky and they're not quite sure? Or what do you normally get?
I have to say, it tends to be people that are quite a way along the line. So it's either, as you say, people that are kind of at that crisis point where actually the symptoms are just awful, they're all the time. I quickly need help to try and kind of find a way of starting to calm this down. Or people that have had symptoms for a long time, and they're maybe not at that crisis point, but they're getting close to it. So, and I think I did it as well. Like, we don't go to see a nutritional therapist or someone else as a kind of preventative thing, like, I just want to make sure that I'm in good health. Or when we start to get a few little niggles, we just write it off, don't we? Oh, it's just a little flare up. Oh, it's just because I'm a bit stressed.
We should be checking in, like going to the dentist. Is everything still okay? You know, are we all right? You know, why don't we go and check things? Why do we get acute situations and go, oh, help me? You know,
help me. And then of course it takes so much longer to unpick all that kind of level of imbalance that's been going on in the body. Not to say that we can't do that, but it will take longer. It will be a kind of longer journey, in the same way that my journey was quite a long journey, because it had been going on for so long before I saw anyone. But actually, if you can get in at the time where you're just feeling like your hormones are, you know, getting more out of whack, you're getting more PMS, you're getting a bit tired, you're getting a bit more pain, then usually it's so much easier to put support in at that point and kind of bring things back in balance, rather than them going kind of further and further, and then we really have to kind of dig deep to bring it back. But yeah, I'm just as guilty as that as anyone else.
Try not to ignore it, you know.
Yeah.
When we do a sports thing, so for example, a lot of people will go, I'm going to go and do a marathon, and then start this training regime. They see a nutritionist, they go and see therapists of varying different degrees of manipulation, etc., manual therapy. And that what they do then is focus. and they start to notice mood changes, weight changes, their whole life changes because they've made that decision. It does look sometimes to me when I see people, why didn't you make this kind of decision just on normal everyday life? Why didn't you just go and see someone and put yourself back into balance? And the reason I'm kind of leading with this is going back to your menopause, perimenopause, menopause situation. Women are tracking through their life. So we will possibly have children. So the hormones are going up and down. We go into puberty and then possibly have children or not have children. And regardless of whether we've had children or not, we all go through puberty and we all go through a menopause. In that time, there's going to be fluctuations of whatever happens, lifestyle changes, grief, etc. That can play a part in the body. When we get to the menopause stage for women, or people that have identified as women, it depends on what's going on with the hormonal changes. When we get to that stage, we are going through a change whether we like it or not. Now, we can either embrace that, and in Japan and China, they call it the second spring, and I'm really adopting this at the moment. I want to go with my second spring. So what we then get to is, how do we do this? And our first line of defense really as a woman is going straight to the GP. I want HRT. I can't do this by myself. I want to go back to being when I was 20. I want this sorted. So I think what I'm asking here, Emma, is we know that change is coming. Is there something we can do in our late 30s? It depends on when the menopause is coming, obviously, but to get ourselves knowledged up, ready for our second spring, how do we get ourselves tooled up? Could we come and see you in advance of that, so we know that by the time we hit a certain level, like Fiona is saying, with the apps, we're monitoring our periods. So is there something where we start to see a change and intercept that before we then end up going, I need HRT, I can't cope? I'm not saying that that's the way people do it, but is there something that we can possibly monitor with nutrition so that the impact of the menopause doesn't go screaming to try and get hormones to try and sort things out? Is that possible?
Yeah, absolutely, Debs, really is. And so it's one of the things I've been doing quite a lot this year, actually, is I've been starting to run what I call kind of perimenopause workshops, which are all exactly about that. So I'm trying to kind of appeal to people from their kind of mid-late 30s to say, you know what, that whole perimenopause transition where the hormones are starting to fluctuate. So you're not in menopause, your periods haven't stopped, but that fluctuation can actually start 10 years before you reach the menopause. So actually starting to prepare for that in your kind of late 30s, early 40s is ideal, because you're trying to kind of get in early before all those fluctuations start. So there's a massive amount you can do with diet to try and put things in place to support you as you go through those hormone fluctuations. So trying to get the foods in that help with hormone balance, that help reduce inflammation, given that inflammation can kind of flare up during those phases. We know things like sleep can become a problem, so putting things in to help with sleep, to help with energy. And one of the biggest things I say to people actually is managing your stress levels is so critical in this phase. I mean, I think for anyone, managing stress is important, but I think for people going through that kind of perimenopause transition, we have to kind of start to reprogram how we think. Self-care is not a luxury during that stage. It is essential. Yes, one of the things that research has shown is that one of the biggest drivers on the level of kind of menopausal symptoms you get is your stress level during that time, because it really swings out the hormone balance. It lowers our progesterone, and that's one of the things that kind of protect us a little bit as we're going through this phase. And then as we get kind of menopause, when our estrogen levels start to drop and eventually our ovaries stop producing estrogen, but our adrenal glands will still produce a bit of estrogen, so they give us a little protective cushion. But when we're really stressed, our adrenal glands are just pumping out cortisol, and so they've got nothing left to produce that cushion of estrogen. So we're giving ourselves a much harder ride if we're going into the perimenopause in a really stressful state. which is difficult because given that age, often people are working, juggling children, caring for elderly parents. You know, it is a stressful time. But yeah, number one is the kind of self-care stuff. This is not you being indulgent. This is critical now. But there's a lot of things, actually, diet and lifestyle, that you can do to help prepare you, get your body in a good place to kind of go through those changes. Or even if you're listening to this and you're in your 40s or in your early 50s and you're like, oh, is it a bit late? No, absolutely not. Even if you're experiencing symptoms, there's a lot you can do with diet and lifestyle to kind of help you manage that, help you get through that transition. You know, you may also be taking HRT, you can still do some of this stuff alongside, but actually if you just want to prepare and try and give yourself the best chance of kind of getting through that with less symptoms, then yeah, there's a massive amount you can do. So either you can see a nutritional therapist, we can kind of, you know, look at how things are for you now, try and get a picture of maybe what might be going on for you in terms of stress, in terms of hormone levels, put something in place. Or what I also am doing quite a lot of is running workshops for people, and that's partly making people aware. So what I see quite often is people in their maybe early mid-40s who are feeling more tired than usual, are feeling more anxious than usual, maybe not sleeping as well, and start kind of, I did it as well, like beating yourselves up, like, oh, why can't I keep up anymore? Like, why am I so tired? I used to be able to do this. Why am I feeling so anxious about everything? I need to get a grip. Actually, it's probably your hormones are starting to shift. And I think often people are primed for, oh, my periods are going to start getting less regular, I'm going to start getting hot flushes. Well, you might, but actually that's later on in the perimenopause journey. Often what starts is you just feel different in yourself. You're tired, you maybe feel a bit moody, you feel a bit anxious, and often we don't recognize that that can be the start of the perimenopause. So a lot of the workshops are about making people kind of more aware of what starts to change in the body and what to keep an eye out for, and then again giving you those kind of diet and lifestyle tools to kind of help you manage that and put you in a better place. But you know, if you do all that and you're still struggling, which some people do, you know, some people just have a harder time sadly than others with it, then absolutely in one-to-one sessions we can put in a more sort of targeted, tailored approach. We can add in some supplements and try and kind of help people through that. It's one of the areas I really like working with, because often you can get good results quite quickly just with some simple changes, some supplements, you know, putting in some support. And people that have been, you know, I had someone who was having hot flushes, she was literally logging them about 14 times a day,
Wow.
and you know, got them right down to, you know, initially it was kind of like 1 or 2 and then eventually occasional. So
Excellent.
you can make a big difference.
Great evidence right there. And also post-menopause, I'm seeing a lot of ladies that I have in my own clinic coming through with post-menopause issues, and doctors are putting them, these ladies are in their, I'd say from sort of 63 to 73, and they come in and they are struggling hormonally. Obviously the cortisol has shot up, and they're all complaining of bellies, because obviously we know that cortisol affects the belly situation. So that they say, I never used to have this, even in my 40s and 50s I never had this, and then all of a sudden they're in their 60s, 70s, they're going to the GP, and the GP's straight away putting them on HRT, and they haven't had hormone replacement for 20 years. So I think post-menopause as well, these women could do with diet changes rather than just being whacked onto HRT. I'm not saying that HRT is bad, because it helps a lot of people, and like you say, Emma, it's a real good, alongside nutrition, you can do the HRT. It depends on how far you are in the journey. Some people are in a really good place, some people are not. Again, it's very individual to the person. I totally understand that. I think from looking at every single person and how they do things, it's more about, what do I need? What is it I need? And working with that person individually, like you say you do. So I think from even post-menopause, there is a way of saying, well, I used to eat all of this when I was in my 20s. But that was 50 years ago. and your body
it's
completely changed, and our lives have completely changed. You know, everything within our world now, nutrition that comes out of the ground, all the genetically modified vegetables, everything has changed over those 50 years. So what you're putting into your body now is probably very different from what you put into your body 20 years ago. Fast food, our whole lifestyle has changed. So I think from going to you or nutritional therapists and getting that advice, or as a therapist myself manually, I would recommend you know, what do they do in their lifestyle, but also perhaps coming to see you and saying, let's get you back on track. And it's not that you're neglecting yourself, and it's not that you're not eating what you should be eating. Perhaps it's the balance of that, you know, or the supplement of that. It's trying to balance you back out, because you're not the same person you were that many years ago.
Yeah, absolutely. And I think we do have to kind of like adapt and change what we do sometimes as our lifestyle moves on, you know, as we get older, as different, you know, maybe health conditions come up, you know, we're in a different hormonal stage. So, you know, I'm in that early part of my perimenopause journey, and I'm certainly having to do things differently. You know, I had my little regime of what I did to manage my endometriosis symptoms, but I've started perimenopause. All of a sudden it's like, oh, that's not quite working. I've had to kind of change and adapt. So we do, and sometimes we do need that advice. And I think the weight gain is such a massive thing, and again something that we can beat ourselves up about, oh gosh, you know, like I'm putting on weight, I'm not exercising enough. And it is that hormone shift. It's also, like you were saying, the cortisol. If we're very stressed, we tend to like hold on to weight. But also as we go through that kind of perimenopause transition, our blood sugar balance starts to kind of go a little bit out of whack, and we're not quite as sensitive to the insulin that would usually manage our blood sugar. So there's all these factors going on that actually work against you in terms of weight once we get to the perimenopause. And I think it's making people aware of that very often it's not you know, you're still eating what you ate 20-30 years ago. All of a sudden you're gaining weight, you haven't done anything different. It's because there are all these other factors, hormonal, blood sugar, cortisol, that suddenly they shift and they work against you. They're effectively now programming your body to hang on to fat in a way that they didn't before. And so we need a different approach to then deal with that. So again, yeah, there's a lot we can do to kind of, I think, make people aware of what they need to do and why, and help give them some of the tools to do that. That is, I always say to people when I'm working, you know, I've worked with a few people going through perimenopause, and one of the main concerns is I'm gaining weight, you know, in a way that I didn't used to, and I don't like it. And I would say, like, you're not going to get quick weight loss with this, because we need to reset the hormone, the cortisol, the blood sugar, and that takes time. So we put the building blocks in. Once we've done that, then you may start to kind of slowly lose weight. But you know, it's not something you get quick results on. You do have to kind of do the work to do the reset, but you can make a difference. It's knowledge is power. Once you know that and you know what to do, you can make the difference.
Well, aren't you? Your own body, you're more in control of it.
But I think there's also that misconception that, you know, well, I say misconception, there's a very popular belief that calories in and calories out is the way that we, you know, can manage our weight. And it's long been kind of shown that we have different ways of processing different, you know, macronutrients and storing them in our body. And really, like, fat in calories in and calories out, you know, there's so much wariness around like different macronutrients like protein and carbohydrate and fat, that we really probably shouldn't be relying on that old kind of outlook, especially in the fitness industry, you know. But yeah, having worked with quite a few bodybuilders, you know, they rely on this system for their purposes of, you know, reducing body fat and building muscle mass. But and that's very well, but actually in a general population we've got other goals. What we're willing to put with.
Yeah, calories don't necessarily mean healthy foods as well. That's why I'm not a massive fan of calorie counting. And so sometimes people come to me for weight loss and I'm really surprised that I'm not telling them, oh, eat so many calories. I'm like, I'm more interested in the types of foods that you're eating and the kind of healthy foods and how we're balancing your blood sugar and how you're managing your stress. And I think, that is a better grounding for weight loss. Sometimes we do have to look at portion sizes and things, but that's, it's not just about that. And I think particularly in that kind of perimenopause phase, like restricting yourself of nutrients, I don't think is helpful. I think this is a time we need to make sure we're getting a lot of good quality nutrients in. It's just doing it in the right way.
Yeah, absolutely. Honestly, Emma, like, you've got such a great way of explaining things. I think there are a couple of things there that you said, about how different organs produce estrogen, and like everything sort of makes so much sense. And I think I hope our audience have benefited from this, the listeners, and I think we've reached the end of our time window now for this podcast episode, but I'm sure we could carry on for at least another hour or two. I certainly have an endless list of questions now. I'll probably email you after this. But if anyone wants to reach out to you, Emma, where can they find you? Do you have social media, website, that kind of thing?
Yeah, I do. So I'm on social media. I'm on Facebook and Instagram as Emma Belton Nutrition. And then you can also find me on my website, which is emmabeltonnutrition.com. And there's contact details on there. So, if you've heard anything in here, you've got an odd question or anything, do just get in touch. The other thing I do is, so for anyone that's thinking, I wonder if nutritional therapy might be for me, I'm not sure, I've tried this before, then I do offer what I call kind of hormone health reviews, which are kind of free 30-minute chats where we can just talk through a bit about what's going on for you, what you'd like support with, whether or not nutritional therapy might be able to help, and if so, what kind of a program we might look at. And then people can either decide, that's something I want to go ahead with, or no, that was helpful just to have a chat, but I don't want to do anything at this point in time. So if anyone does want to find out more, then if you just go on my website, it tells you how to book a hormone health review.
Incredible. Such a great resource. Like, I'm sure that people will be, I hope people will be looking at that seriously. And if you're listening and you're not sure, there's probably a good reason why you're maybe listening to this episode anyway. It might be an indication that either people who need help or you need help. So I hope that people will be in touch with you. I hope the listeners will be in touch with you. So I think that's all that we've got from Emma, Debs and me. Debs, is there anything you want to add, or are we
so off air, Emma, you were saying that you do some Instagram live occasionally. So can you just tell us where we find you on the Instagram live?
So again, if you just go to Emma Belton Nutrition on Instagram, and I run the Instagram lives with my friend Kat, who is a yoga teacher. So she's on Instagram as Yoga Full Studio, and we try and do them once a month. So they're always on a Monday. We alternate. Sometimes they might be lunchtime, sometimes they might be evening, and we'll have a topic. So we've got one coming up on perimenopause actually in a couple of months. We've done them on the immune system. We're also doing one on pain actually, I think towards the end of the year. That might be interesting. So if you follow me on social media, on Facebook or Instagram as Emma Belton Nutrition, then we start promoting them beforehand to kind of let you know the dates and the topics. And then you can just join. So we do about 20 minutes. We kind of chat through how nutrition can help with whatever topic it is we're talking about, how yoga can help, and then we open it up to any questions.
Fantastic.
Yeah, those questions come in by comment, don't they? You were saying. So
yes.
So Emma can't see you, but you can see her.
Yes.
Awesome. So we'll put the links to all of your social media and email and website handles, things at the bottom of this in the comments, in the description of the podcast episodes and on YouTube. Yes. So thank you, Emma.
Welcome. Lovely chatting.
yeah, like hopefully you'll be hearing from lots of our listeners soon. And just to wrap up the episode as well, so if you are listening and you want to listen to more episodes, and you haven't already, you can subscribe to the podcast through all of our popular platforms on Apple Podcasts, Google Podcasts, we have Spotify and YouTube, you name it, we've got it. So if you click on subscribe, you'll be able to be updated when we've got a new episode coming out. We have series 1 is also available, and several episodes from this series 2, if you want to catch up on anything you've missed. Social media, our Instagram and Twitter handles are at UK_WIST for WIST. And if you need any more information at all, you can email us at wist@thesta.co.uk. And there is more information on the STA website at thesta.co.uk. No at the front, it's the website www. And I think that's everything on our long list of comms. I know this off by heart now, but yes, it's been fantastic to speak to you, Emma, and we really have enjoyed learning all about the nutrition side of things, so thank you. And I guess that's us from this week, or this month even, so we'll see you in the next episode. Bye everyone.
Bye.
Bye.